My name is Dare Dickson. I'm a social worker with Lagos State. And a social worker, basically, in summary, I cater to the psychosocial needs of patients, the patients that are referred to me. So when I say psychosocial, it involves the psychological needs of patients and also the social needs of patients. I'm not a doctor, a nurse. The doctors and the nurses, they use drugs. But I use what we call a talk therapy for the psychosocial needs. And through my talk therapy, I'm able to find out the need of my patients. And I know if it's a psychological one or a social one. Then I render the relevant intervention. Okay, over the years, I've had lots and lots of patients with psychosocial needs. More of social needs lately due to the economy. And over the years, I've seen people lose their life for as little sum of 1,000, 2,000, 4,000 because they couldn't buy a specific drug at a particular time. And when I just became a social worker, we didn't really have partner organizations like we do now. Because then it wasn't very common. But thank God, at least the awareness is better, and we have more and more people that are interested and are finding out how they can come in to help the less privileged and the vulnerable people in society. Health Emergency Initiative is one of the best partner organizations we've had so far. Because like I said, when I started my practice, we had people that died for as little sums of, because of little sums of like 1,000, 2,000, 3,000. And then when HI came, they were like a breath of fresh air. And they're very accessible. And some NGOs will come with large amounts of money, but you see them once in a while. But HEI has the system in place that once you have an indigent person, just reach out to them. And they do it. They cater to the drugs or the medical investigation or admission. They have fixed amounts, yes, but it's regular and it's life-saving. For me, they are about the best NGO that I've worked with so far because my mind is at rest. I can always tell the doctors, go ahead. Whenever they refer indigent patients to me, and once I intimate HEI, I can always tell the patient, the doctors, don't worry, help is on the way. We don't lose lives anymore, thanks to them. I'm very confident about them. Once they say go on, it's go on. They've not failed since I've been working with them. We've been able to save lots and lots and lots and lots of lives because of that initial first aid that they give me the confidence that now in my hospital, they know that once there is an indigent patient, just save the life. HCI is there for me, for the basics. So for me, it's like I said, they're a breath of fresh air. They are my number one NGO, and I've worked with several NGOs and several humanitarians, but they have been the most constant and they have been the most reliable. They are just a phone call away and the help is on the way. Okay, so let me educate us a little bit. There are different spheres of social workers. We have family social workers. I'm an hospital social worker. There are community social workers. But the richness of being a health social worker is that patients come to the hospital for different reasons. I just got a call now of a rape patient. When patients come in and they see the doctor, if it's a psychological issue or a social issue, the doctor refers to the social worker. And it's not every patient that needs medical help. Some of them needs to be linked to the appropriate centers where they can. Like a rape case now, the doctor will do their own part, but we'll have to link up with where the victim can get justice, which will not be in the hospital. So there are different spheres of social work. So,
I have a question.
social work is well, should we say, maybe still relatively new, but the awareness is increasing daily. The world is a global village, and social work it's now, a lot of universities are now taking it as a first degree, second degree, even to the doctorate level. So more and more people are becoming more aware. Social work is a helping profession, just like medicine and nursing, and The awareness is increasing day by day. And one person can tell one person, now that you know about it, you can also talk to people around you, and the awareness continues like that. It's important that we speak up. We shouldn't die in silence. Gone are the days, the era has gone when people should cower and just die in silence. But now, everybody's entitled to a life of dignity. And so don't suffer in silence, don't die in silence, speak out. Whatever the issues are, speak to someone, speak to a social worker about it today.
Okay, give a shout out to HEI and the future
Okay, I'm giving a shout out and thumbs up to HA and future projects. God bless you guys for the great work you're doing for humanity. Thank you very much.
Spell emergency in 10 seconds. Spell emergency backwards in 10 seconds.
YCR EM